Mshengu are visiting a matric exam marking center in Umlazi in Durban. Let's go there live.
Instructed MECPLA to engage with big employers. All companies that are employing hundreds of people should be engaged and should ensure that they follow also precautionary measures. As government, through MECPLA, we are also working on partnering with the private sector to conduct testing of workers in various areas. So we will do everything to support the various industries, but we will equally do all we can to protect the people.
Premier, the issue of a surge in infections in the province continues to be a worrisome issue, even though there are these regulations, restrictions that have been put in place, but the province still experiences quite a significant high number of infections. What can be done to address this?
Well, two things are important here. Why the surge? The surge is escalating because we as ordinary people, all of us, should take a blame. We don't follow precautionary measures that are in place. If there are funerals, we would want to follow rituals and that contribute to the spread. If there are funerals, some funerals are attended by more than 50 people, and that is not in line with the protocols. And that's why the president took time to address this issue. And there are those who continue to converge. Either in townships or rural areas, they will continue to play soccer and do such things. And that also contributes to the spread. There are those who continue to drink together in taverns, and that continue to spread. What can be done? We as government are trying to once again ensure that the screening and testing program is rolled out throughout KwaZulu-Natal, but the tracing is the more that is important. Once we identify someone who has been infected, we must then be able to get contacts and then ensure that they are also tested.
Thank you very much.
Premier, still on the follow-up.
Last one.
Yes,
Okay,
the last one.
Okay.
Premier, still on that one. We've had some field hospitals like the Royal Showgrounds and some hospitals that were converted to accommodate the patients of COVID-19. As the province, are we planning to reopen those hospitals and also look at the hospital which is at Kwamashu, the hospital that we were promised that it was going to also be used for COVID-19 patients? How far are we from the opening of that hospital?
The Pilsika Isaka Semi-Hospital, which is located in the Kwamashu, Inanda and Tuzuma area, is one of those that were earmarked. But with the first wave, we thought that there would be, after the first wave, we thought that there would be no need to use it. Now, the second wave have hit us, and the department is working on ensuring that the hospital is repurposed with speed to take patients of COVID-19. The Royal Show and other field hospitals, it is the same. The department is considering that. But we are not at a stage where we should panic because the bed capacity is still there. It's not, we have not run short of the bed capacity as the province.
Thank you very much.
NgeZulu singasho ukuthi njengo KwaZulu-Natal siyafisa ukubonga ubuholi buka mongameli ne-National Command Council ne-Cabinet. Sihambisana kakhulu noku-extendwa kwa level 3 we-lockdown, and lokhu kubalulekile ngoba kumele sibhalansise impilo yabantu bakithi, impilo sibhalansise nani nempilo ngokomnotho. Yingakho futhi through MECPLA sesithatha i-decision yokuthi sipartnerishe nezimboni ezinkulu ukuthi kuqinisekise ukuthi kuyatestwa abasebenzi njengoba inkampani ezinkulu zivulile ngomsombuluko. Siyafuna ukugcizelela kumina nawe umuntu nomuntu ukuthi sehlise sinqande ukubhebhetheka kwalesifo. Kusiphatha kabi ukuthi sibona abantu uma kunemingcwabo.
Of course, it's a national conversation how the National Departments of Education are going to be dealing with ensuring that if they avoid at all or just lower the levels of infection in terms of markers, as we prepare to hear how the class of 2020 performed in an epidemic, in a year where we were facing COVID-19. Now, acting Eskom Fuel Resources Senior